This morning, there's a big debate raging online right now over new medical charges popping up at local hospitals.
Yeah, patients are being charged for asking questions online. This all started on a Reddit thread that's picked up hundreds of comments in the last 24 hours. The person who started it says Houston Methodist charged them for asking their doctor questions in the MyChart app, and they warned others about what they called, quote, bogus charges. Now, this morning, some people are pushing back. One user posted, quote, does your question require a physician's medical expertise to answer? If so, they should be compensated for their time, period. Another said they hoped it would cut down on people wasting doctors' time, adding, quote, doctors are having extreme burnout, especially from inbox management. People think they can just message their doctor for anything and often, end quote. And it turns out these types of charges aren't really new. In fact, we've covered them before. And this morning, Brandy Smith explains why we're seeing them at hospitals around the country.
Why could it cost you the next time you email your doctor? According to the New York Times, more hospitals and medical practices are charging for your doctor to respond to an email, including Houston Methodist. Not all emails will cost you. Things like prescription refills, scheduling an appointment, and follow-up questions are all okay. But some providers are now charging for things like changes to your medication, new symptoms or issues, and big changes to long-term conditions. The Times says the move isn't just a money grab, but an effort to help doctors dealing with more and more digital requests these days. According to experts, it appears the pandemic accelerated this demand, with research showing patient emails increased by more than 50% in the past 3 years. This left doctors swamped, often responding to emails well after work hours. But critics say this move could discourage people from asking for medical advice when they really need it. The fees can range from a copay as low as $3 up to a charge of $100 for the uninsured. Some experts warn increasing communication between patients and doctors is a good thing, and charging for the service could reduce that communication. With The Why, I'm Brandy Smith.